Greetings. Let us talk about Barrett's esophagus and how one should take biopsies. This is normal esophageal anatomy along with gastroesophageal junction. So this is the diaphragmatic hiatus through which the esophagus enters into the abdominal cavity. So that's one measurement that you'll be taking during endoscopy. This is the junction between the squamous lining of the esophagus and the columnar lining of the stomach, the squamo-columnar junction. This is gastroesophageal junction. You measure that at the top of the gastric folds, where the gastric folds end and the tubular esophagus starts. In summary, whenever you examine the esophagus, especially the lower end of the esophagus, you want to take measurements of the diaphragmatic hiatus, squamo-columnar junction, and gastroesophageal junction. Three important measurements to take. Let's move on to Barrett's esophagus. This is replacement of the distal squamous lining of the esophagus by columnar lining of the stomach along with intestinal metaplasia. The intestinal metaplasia is confirmed by taking biopsies of the columnar lining of the distal end of the esophagus. So when you see somebody with Barrett's esophagus, you want to do several important observations. First, you want to document whether there is a hiatal hernia, and then use the Prague classification to document the circumferential extent of the Barrett's esophagus as well as the maximum extent of the Barrett's esophagus. Let's go step by step how to do this. Once you enter the stomach with your endoscope, and as you pull back, you look for the diaphragmatic pinch. That is where, as the patient breathes in and breathes out, there is a little bit of a circular constriction that you could notice, and that's where you take the first measurement, the diaphragmatic pinch or the diaphragmatic hiatus. So say for example, in this patient, the diaphragmatic hiatus is at 40 centimeters, and then as you pull back your scope, you measure the top end of the gastric folds, where the gastric folds end. And in this case, the top end of the gastric folds or the gastroesophageal junction is located at 37 centimeters. By looking at these two measurements, you measure that the hiatal hernia is 3 centimeters. Next, let's look at as you pull your scope back from the gastroesophageal junction, you come to the squamo-columnar junction, and in this case, the measurement is 34 centimeters. So the distance between the squamo-columnar junction and the gastroesophageal junction gives you the circumferential extent of Barrett's esophagus. In this case, 37 minus 34 equals 3 centimeters. Next, as you pull your scope back further up, you see the top of the Barrett's esophagus tongues, in this case located at 33 centimeters. And looking at the GE junction and the top of the Barrett's tongue, that gives you the maximum extent of Barrett's esophagus, of about 4 centimeters. So when you comment on Barrett's esophagus, you give a comment saying that the C or circumferential extent is 3 centimeters, maximum extent is 4 centimeters. In other words, you could put it as C3 M4 as the value. So in summary, this patient has a 3 centimeter hiatal hernia with a Barrett's esophagus, the circumferential extent of about 3 centimeters and a maximum extent of 4 centimeters. So this is how one should report the lower end of the esophagus, especially when you say Barrett's esophagus. If you don't see Barrett's esophagus also, it's important to measure where the hiatus is, where the squamocolumnar junction is, and where the GE junction is as part of your routine. Coming to the biopsies, the protocol suggests, the Seattle protocol suggests or recommends taking 4 quadrant biopsies at 1 to 2 centimeter intervals, starting from the top of the gastric folds, that is the GE junction, to the top of the columnar tongue. When it comes to taking biopsies in a tubular esophagus, it is a little bit technically challenging, and I like to take you through the steps of how to do biopsies of the Barrett's esophagus. So once you're in the columnar lining, you start taking biopsies from the distal end of the esophagus, and as you move up. When you take biopsies in a circumferential manner, try to take biopsies in the dependent portion of the esophagus first, and so that if blood pools down, it doesn't interfere with your vision. And coming to the technique of biopsies, you push your biopsy forceps out, open the forceps, pull it back to the tip of the endoscope, turn your scope towards the wall or the target area of the Barrett's lining, and then push your scope gently or the forceps gently while you apply a little bit of suction to allow the mucosa to come into the cups of the biopsy forceps. Close the forceps and then gently pull back to take a biopsy. This is how you do Barrett's esophagus biopsies. Thank you.